What he's talking about are a couple of things. First of all, let's talk about healthcare, and let's talk about the enormous crisis that exists in healthcare, and let's talk about the fact that the United States, along with South Africa, is the only industrialized nation in the world that does not have a national healthcare system. The cost of healthcare in Vermont is zooming upward as it is all over the country. Okay? What you have in our country, and I do not mean to condemn all doctors by any means, we have some wonderful doctors, but essentially you have medicine being practiced as a business. Okay? I think we need radical changes in the way healthcare is operated in this country. We got to have a national healthcare system like Canada. One of the things that we're doing in Burlington, Vermont is I appointed a task force to look at the issue of affordable healthcare. And one of the things that we did is we went out to Canada. We went to Ottawa, Canada, and we went to Montreal, Canada, and we looked at what they're doing there. I wonder how many Americans know that our neighbor to the north, Canada, which is a poorer country than we are, has a national healthcare system which guarantees full health care to all of its people without any, or almost without any, out-of-pocket expense. You get sick, you go to the doctor, you go to the hospital, you take your little card out. The cost of health care in Canada is escalating less than it is here in the United States, where it's going off the roof, because the government basically can control the cost. It sits down and negotiates with the doctors, it negotiates with the hospitals, and it says, we want you to keep the increase to the rate of inflation. In this country, it's going up 10% a year, 15% of the year. You have doctors and hospitals and drug companies which are making tremendous profits. So we need a radical change. Now, the point that this person makes, this caller makes, is, let me tie that to the whole issue of medical education, which he touches on. One of the problems that you have is that in this country today is that to get a medical school education, it costs you a huge sum of money. Tuition is $10,000, $15,000. So the average doctor is already $50,000, $60,000 in the hole by the time he or she graduates. You get married, you have some kids. What's the first thing you think about? You say, boy, I'm going to make a lot of money very quickly to pay back this debt. Clearly what you need is something akin to Canada, where tuition is $1,000, $1,500 a year, where the government subsidizes it and says, we want quality doctors, and we don't want people who are simply going to be money grubbers.